my name is Clare Owen. I am a director at the Medical Schools Council, and I'm going to be hosting this webinar today. I have a fantastic panel here. I have Peter Leadbetter from Edge Hill Medical School and Chinedu Agwu from Brunel Medical School, and they're going to talk about their medical schools and some advice on picking the right medical school and gateway courses. So really good session today. Peter, you're going to start us off. You've got a presentation, haven't you?
Thanks very much, Claire. Yeah, I'm Peter Leadbetter. I've got a lovely picture of Edge Hill University, and that's where I am at the moment. I'm the admissions and selection lead, and I also lead the foundation year for medicine at Edge Hill University. And that's really what I'm going to talk about today, is foundation and gateway years for medicine, and what are the criteria that they generally look at. Okay. Okay, and this might sound obvious but I think it's important to give a little bit of context. In 2023, there were 44 medical schools. I think there are currently 46 at the moment. And this includes new medical schools or relatively new medical schools in England, Wales, and Northern Ireland. So there's a lot of choice. And there are typically three types of medical courses. That's traditional entry, graduate entry, and medicine with a foundational gateway year. I'll talk for just a minute about traditional and graduate entry because I know it's important, but I know that's why most of you are here to see about the foundation year or gateway year. So I'll spend most of my time on that. Okay, graduate entry, there are 17 graduate entry medical programs across the UK in 2023. Most of the courses, they ask for a previous degree, clearly, because it's a graduate entry program, and that's usually a 2-1 classification or sometimes a 2-2. Most of these courses accept students with a degree in any subject. However, some specify that the degree must be within a health or a science-related field. They're typically, although not always, 4 years in duration, but in some universities it's 5 years. Okay, the next one is the traditional entry, which is where most of the medical courses are traditional entry. It's typically 5 years. They have different abbreviations. You might have seen MBBS or MBCHB, but they're essentially the same degree. Several medical schools that offer traditional entry also offer a foundation or a gateway year, and that's what I'm going to talk to you about now. Okay, well, what's really important, and we're all here because we want the medical workforce to represent the population it serves. There have been significant steps. We are widening access and participation in medicine, but there's a lot more we can do. And foundation and gateway year courses aim to redress some of those imbalances, try and get people from varied backgrounds to study medicine. So there are 17 of those that offer a foundation or a gateway year. They're typically almost always designed to support access and transition into university. And these are for students who have the ability, but may not have had the opportunity to reach their academic potential. And that's due to a number of different reasons: social, economic, educational, or all of those reasons. So they've had barriers to accessing medicine. What these courses typically do, is they offer contextual admissions. So they have adjusted criteria. And I'll show you examples of this in a few minutes' time, which they sort of implement on condition that you meet some of the widening access criteria. So these can include an adjustment in grades, an adjustment in UCAT scores, various factors that can influence admissions. Some focus on bridging the gap and focus entirely on the academic attainment. In other words, upskilling people, ensuring that they meet the required academic attainment to enter medicine, to apply for medicine. While most of the others focus on, yes, the academic attainment and academic credentials, but also on personal and professional development. And that is preparing you for medicine, preparing you for the transition into higher education, and supporting you that way. Most of these courses are 6-year courses. So the first year, they often call it year zero. They might call it foundation year, year zero, gateway year. But most of the courses are a 6-year fully integrated program. Okay, and I said before that traditional medicine courses are 5 years. Often gateway or foundation year courses are part of a fully integrated 6-year course. What that means is typically if you pass your gateway or foundation year, you're guaranteed direct entry into that course at that university into year one. Okay, this is, I won't go into a lot of detail here, but this is from the Medical Schools Council website. It's a really nice page. So the link is there, but if you click on that page, you can see all the foundation and gateway for medicine courses that are offered throughout the UK. And they list all the requirements within that. They list what the academic requirements are, how they use personal statements, what admissions tests are used, what interview method, what work experience. I mean, you can read. So widening participation criteria and contextual offers, which often goes hand in hand with widening participation, which I'll talk about in a minute. Okay, and this is just, I've tried to summarize, there's huge variation across the 17 programs, but just about all the programs have adjusted academic requirements if you meet the widening participation criteria. I'll show you an example in a couple of minutes' time. But if you meet those certain criteria, you have a grade reduction or a couple of grade reduction in entry. Personal statements are used in a variety of ways, but most of them are not scored. So most of the institutions specify that they'll read them, they might check them, they might be used to differentiate between candidates who score similar at interview, but most of them are not scored, but they are used. Admissions tests, most courses use UCAT, that's especially in England, but there are some variations within that. Interview method, predominantly multiple mini interviews, although a couple of institutions still use a panel type interview rather than multiple mini interviews. And work experience, and I think this is critical. A lot of institutions recognize that it's difficult to get work experience, particularly in healthcare, and that's often connected with the people you know, the networks you're in, who you know in what particular organization. So a lot of institutions outline that work experience in healthcare is not required. However, if you do have that, then they recommend that you draw on that in the interview process. So it's not required. What is required is some kind of reflection and awareness of your strengths and limitations with examples. Widening participation, the criteria varies, but there are some consistencies across many courses. And I'll talk a little bit about the types of things that they're looking for in a few minutes. But there are a number of different variables around widening participation. And I think it's key to understand that different institutions might have a slightly different focus. It might be widening participation, but they tend to focus on particular groups. So it might not be widening participation for all at one institution. Contextual offers, and this is what I spoke about before. And so this is really about the reduction in academic grades or even a UCAT adjustment, asking for interview, or occasionally completion of a widening access or an outreach program could be in your benefit and support you in gaining a place in a foundation or a gateway course. I think the best way to demonstrate this is an example. Of course, I'm going to use Edge Hill University. It's where I'm from, and it's what I know best. But I think it's consistent and similar to a lot of institutions out there in terms of the criteria and what we're looking for. Okay, so hopefully this will help clarify some of the points I've raised. Academic requirements. Now, typically for medicine, it's straight A's at A level or equivalent. Okay, that must include chemistry and biology. At Edge Hill University, for a foundation year, which is part of a 6-year course here, we'll accept candidates who have B's, and that includes B in chemistry and biology and one other. And that's subject to meeting the WP criteria, which I'll get to on the next slide. The personal statement, We don't use the personal statement as far as scoring it for selection, but we do read them. Okay, we read them just to check and to clarify things. And if a couple of candidates have similar scores, for example, at interviews, then we'll read the personal statement and decide who to make the offers to. The admissions test, we use the UCAT, as most institutions do. And we also do, for interview, we have multiple mini interviews. And our interviews, our multiple mini interviews, we interview both the foundation year and the traditional 5-year candidates at the same time. Same questions in the same time. Sometimes the scores required to be provided with an offer differs depending on the foundation year or the traditional route, but we do have the same questions and the same process. What we say to candidates who are interested in the foundation or gateway year is if they're offered a place and they go through the same interview process as traditional candidates, then they're offered a place for 6 years. They don't have to go through this process again. And as I mentioned before, we don't specify any work experience, but what we do at interview is we ask you to draw on your personal experiences within the interview, and that could include some work experience. Okay, I'm almost done, but the widening participation requirements that we specified, some of these might be similar to other institutions. The first one is not really. I think this is quite unique, and I don't think there's many courses out there that have this geographical requirement. But for us, the candidates must have lived in the northwest of England, which is where we're based, for at least 1 year prior to application. The next two are quite typical of a lot of the foundation and gateway courses. So you must also meet one of the following 2 points, not both, but one. So have attended a non-selective state secondary school. So that's one that's not a grammar school. That's not where they have selection tests to enter for GCSEs. And that's where attainment 8 score is below the England average. So that's just a school, that's a school who's performing below the average nationally. And that's one of the criteria. Or have attended a non-selective state school without the attainment 8 criteria and live in an area which is deemed to be brook deprived. And the way we do this, and the way a number of institutions do this, is on the website, our entry requirements, you can click on links to ascertain whether you meet those requirements for attainment 8 and your postcode is classed as deprived. We also have a number of other widening participation criteria, and I'll quickly list them, but you don't need to meet all of them. You only need to meet one of those. And that could be something such as your parents haven't gone to university. It could be, if you could use the second one above, so you can use both one above and one below. It could be you've been in care. It could be things such as you're a refugee or asylum seeker. We could also look at your postcode. There's a number of different things we can look at. Free school meals. And as I said before, we don't specify that you need to meet all of those requirements. It's just one. Okay, so it's lived in the northwest of England, then we look at your school, and then we look at one other criteria. Hopefully that's enough detail to get you started. But what I would recommend is you go on the MSc website. It's a really good starting point for getting all this information and in more detail. And you'll see that the foundation and gateway courses are spread nationally and throughout the UK. So there is local courses to where you live. But the whole aim behind this is to make medical students more representative of the population. And most of the courses are there to give you academic and professional support. For the transition into medicine, there are lots of options, and they're often part of a fully integrated 6-year medical program.
Thank you very much, Peter. That was brilliant. I think there's only, off the top of my head, the other school that does a regional selection is not quite the same. You have to be from the northwest to go to yours, whereas there is Anglia Ruskin will give you extra points if you're from a geographical area that is one of their targets. So I think you are fairly unique in limiting that the intake to that particular geography. Chinedu, do you want to give us your presentation?
My name is Dr. Chinedu Agwu. I am a lecturer in biosciences and the academic lead for widening participation at Brunel Medical School. And so today I'm going to share with you about Brunel Medical School and why you might consider choosing a new medical school. Right. So Brunel University, it was voted first for most international university in the UK by Times Higher Education World University Rankings. So that was a proud achievement for the university. And what's great is that it's a one-site campus in London. So everything is in one place, very easily reachable, which is a nice, intimate environment for students. It's a leading research-intensive UK university. It has a reputation for delivering first-class health professions courses, with medicine being one of them, with over 8,000 international students, about 150 or so nationalities represented, and over 11,000 UK students. So now I'll just focus in on medicine at Brunel. So it is a 5-year program, and we are a young, dynamic medical school. We are 3 years in, with 2 more to go before we graduate our first cohort. Now, well, since September 2024, we have been open to UK and international students, but initially we started off with international students. We have about 100, just over 150 places available for our 2025-26 entry. And we are very fortunate to have an experienced and diverse faculty who teach our students. We are powered by technology, which we try to use in our teaching approach. We have very pioneering approaches to our teaching and learning, which I'll go into detail on later on in the slide. And of course, we have a very EDI-informed approach to everything we do, from our students to our staff and our curriculum. Okay, so now I will go into detail about our curriculum. We would describe it as bespoke. It's modern, up-to-date, integrating science with clinical practice. The teaching approach we use in the medical school is team-based learning, where students are divided into teams of 6 according to different factors such as gender, age, whether they've studied A-level biology, whether they are a school leaver or a postgraduate student. So at the end, we end up with balanced teams who learn in a classroom. There's high quality anatomy teaching and early exposure to the GP placements, which I'll talk about later on. And what's great is that we formed an equality, diversity, and inclusion checklist to ensure that the curriculum that we built actually reflects the students that we're teaching and society at large. And here's just the schematic of our learning. So starting off with foundations of medicine in year 1 and 2, where we're just, going over basic science principles. Year 3 to 5 are the clinical years, and that's when they get integrated clinical care and go on their medical rotations. Right, so team-based learning, so the main teaching approach, very interactive, building on collective intelligence and promoting collaborative learning. So you learn specific science principles of medicine and apply that to clinical practice. Students learn to communicate effectively within their team, but also to members of staff, being able to ask questions and challenge on certain questions if needed. It's a flipped learning style approach. So staff record high quality lectures online, which students watch, and then they come into the classrooms and complete a quiz. before then doing that same quiz with their team. And then there's a chance to have an open class discussion with the member of staff in the room. And what's great about team-based learning is that there's also team teaching, where the staff members comprise of a scientist and a clinician working together to teach the students. So you have that scientific perspective, but also the clinical practice application. And in the room, there's normally a team-based learning facilitator directing discussion and managing the classroom dynamic. And here you can see our students discussing. So moving on to anatomy teaching. So we have our practicals, which take place once a week with preparation learning resources. We have a state-of-the-art anatomy suite, plastinated human specimens. So this is an alternative to some medical schools. Plastinated human specimens are odorless, they are dry, and it's an authentic experience to learn anatomy, but also pathology. And more medical schools are moving towards that. We have TV screens for radiologic images. We have tabletop light panels for visualizing transparent thin slices of materials, and the use of ultrasound on real simulated patients incorporated into practicals. So these sessions are very dynamic and interactive. Okay, so now I will talk about the new facilities. So Brunel Medical School is in Quad North. That's where we are. We're very close to student amenities. We have simulated hospital wards. So I'll try and play that here. So I'll let that be playing there. I've already mentioned the anatomy center. We have 2 clinical skills labs where they can learn about venipuncture and other clinical skills. We have the student social space where students can relax and play pool. And we have our own dedicated medical school student support and wellbeing office for students to just have wellbeing checks. So clinical placements. So as I mentioned, we do have early patient contact starting from year 1. We have affiliations of local GP practices where students are allocated to. Hillingdon Hospital is a roughly 10-minute walk from us, and other leading hospitals and centers of excellence. So this means that students get that hands-on clinical experience supported by leading clinicians, but also access to diverse patient communities with diverse needs. Now, house systems. If you think about Harry Potter in a way, we have a similar house system. And these are all clinicians who have made a significant impact in medical history. We have 5 houses, each with their individual logo, designed by our students. Very artistic, aren't they? And we have a senior house tutor for each of these houses. And so each term we have house meetings where students can meet, chat, play games, but also feedback to staff about how the term is going, any feedback they have. We also have more relaxed events such as med balls, sports days, and fundraising for charities. So I'll quickly talk about admissions entry. So in Brunel Medical School, the GCSE requirements are 5 GCSEs at grade B, at least a C in English and a B in maths. We accept this grade range for our A-level students. And for IB, we expect 36 points. So higher level 6 in chemistry or biology and 5 in maths. And going back to A levels, I forgot to say, A can be in chemistry or biology, and a second science, which again could be chemistry, biology, or physics, or maths. If We have our bachelor's degree, master's, but I don't think that's applicable to this crowd. But then it's a 2-1 or a merit for the master's. And as Peter already mentioned, typically the entrance exam is UCAT, and that at Brunel we do actually use the UCAT quite strongly to shortlist for our MMI interviews. So when students do their UCAT, we rank the students according to their score, and then from there they're selected for the interview. And band 4 in the situational judgment test is an automatic rejection if they get a band 4. Okay. So I'll just quickly go over MMIs. It's online. It's a 6-scenario-based interview lasting about 5 minutes each with a different interview assessor. And as I mentioned, it's used to help select students with the qualities and cognitive skills we believe will, make good, competent doctors. Each student is given a mark for each scenario, so that they would get 6 different scores. And then these scores are added up. If they meet the threshold for an offer, they'll be given an offer. If they're at borderline, they may be put on the waiting list. But if they're very much below the threshold, they would receive a rejection. So no applicant will be made an offer without an interview. And it's important to know, I've got the scenarios. There are 6 scenarios: commitment to healthcare, team working, ethical reasoning, data interpretation, empathy and perspective taking, and resilience and adaptability. So those are the themes. Now, finally, widening participation, and Peter has kindly given you some context to widening participation. As a new medical school, we're still developing in this area, but we're hoping to develop our contextual offers by 2026 entry. We are currently doing outreach activities, going into schools, giving career talks. We also invite schools on campus and we deliver clinical skills workshops so students get that hands-on experience. We also work with allied health professions like physio, nursing, occupational therapy to run some of these workshops, just so students see a breadth of healthcare professions. Most recently, we've received funding from the MSc, the Medical Schools Council, to run a summer school this year. And this will be in collaboration with Imperial, and we'll be hosting 50 students for this. In terms of finances, we currently have financial support for care leaver students, as well as estranged students. And I had a video here, but because of time, I probably won't show that. So yes, thank you for listening and happy to answer any questions you have.
Brilliant. Thank you, Chinedu. That was great. So definitely got some questions, but I'm going to start with one of my own, chair's prerogative, and that is to Peter, because Peter, you are also from a new medical school, so you're graduating your first cohort this year. Am I right about that? So you're at the end of 5 years, and can you tell me what reflections do you have about what are the benefits or about choosing a new medical school, and also about the sign-off process, because we were having a chat beforehand and the GMC are actually in this week talking to you, aren't they? So some of the regulation oversight and just your reflections on having, started a program and being from a new school.
Yeah, thanks, Claire. What struck me immediately was the similarities. So lots of the things right from the admissions are very similar. Through the MMI scenarios, the facilities, and I think this is the first question, but what's been really nice for us is because we're a new medical school, we have the opportunity to shape things as they go, which can be a bit more difficult from what I understand in some of the more traditional medical schools. We can set our stall up from the beginning. We've had an emphasis on mental health and community care and giving back to the local community, and that's been core to what we do from the start, as well as widening participation. So there are lots of similarities, which we've just spoken about. Things such as the balance as well, the students between the sort of academic and the student societies, the students forming their own groups. I know Chinedu spoke about a house system. We don't have that, but of course the medical students have formed their own groups and societies. They have a medical school ball. And we're coming to Claire said at the end, we're coming to the stage where our first students will be graduating this summer. So our current 5th year students, or some of the foundation year students, which are about half the cohort, have been here almost 6 years. And we're at the stage where the GMC are here today. They're asking us questions. They're talking to the students. They're visiting our placement providers. Things are going well, and we're hopeful that we'll be signed off soon and will be fully recognized or registered with the GMC. But that's a long process. They don't take it lightheartedly. The whole process of going through GMC approval takes at least 5 years, sometimes longer. They visit regularly, they check, they ensure we're keeping to the standards. So I guess for you as students or potential students, it's a kind of reassurance that
Yeah,
things aren't done ad hoc. It is thoroughly checked, it is thoroughly investigated. We all have contingency medical schools that
absolutely.
we work with. We work with them to ensure we're on the right track, and they're established medical schools, and they're in place. Worst case scenario is if things don't go according to plan, the students can be picked up by that contingency school. But that's not going to happen at us
No.
or Brunel or that Brunel. That's
No.
not going to happen anywhere. But it's a thorough, systematic, and thought out process.
Yeah, and I think to summarize that, there is a contingency plan, but because the quality assurance is so rigorous and it happens continuously, there's lots of talk and discussion between GMC and the school about where things need to improve, what needs to be considered. So the fact that it's quality assured the whole way through its development and there is a contingency is like a belt and braces approach so that you can feel very confident to pick a new school in terms of there's absolutely minimal risk of that school not passing quality assurance, and even if it did, you would still get a degree at the end because the contingency school could pick it up. And I think that's a really important thing for applicants to recognize, because you might think, oh, well, this one's been doing it for, some of them, 300 years, and this one's only been doing it for 5, but everyone's regulated the same, and the same quality checks are in place, and there isn't really a risk to going to a new school. And I think that's really important to take on board. We've had some questions. I'm going to start with neurodivergent students, or students with auditory issues. You've both talked about team-based learning classrooms and that approach to learning. Have you had to make any adaptations as you've implemented that? Chinedu, do you want to start with that one?
Of course, yeah, this is a question we often do get, and it's a very important one. So we actually do have a student with who does need that additional auditory support. And what was great is that this was communicated to us early enough. So it's a shame I didn't show you the schematic diagram of the classroom, but we ensure that where she's sat is as close to the front desk as possible. So when we are speaking, we're making announcements, directing the discussion, she's the closest to the mic, so she can hear the member of staff speaking. And what's useful is that we have ceiling mics as well as the handheld mic to try and pick up the sound. We encourage students to stand up and project their voice. And as facilitators, we try to summarize the question that was asked, just in case it wasn't heard. And, just ensuring that people talk loudly, slowly. And in terms of neurodivergent students, we try to apply reasonable adjustments where possible. So for the quiz that I mentioned at the beginning, we have a set of students that are in a separate room for that, and they're given extra time. So it's a different learning environment, and they get given extra time. But we then do reintegrate them into the wider classroom, because the reality is these are going to be practicing doctors in the NHS, surrounded by nurses, physios, patients. So I think it is important to help them to adjust to being in those kind of busy and sometimes noisy environments. Yeah.
Well, I think medical schools in general are quite set up and understand the needs of neurodivergent students.
Yes.
Yeah. Had another question about that. I'll start with you, Peter. How do you handle that transition from school to medical school? So it's a big leap in many ways, isn't it? It's being away from home for some people, you know. So what support systems do you have in place for that, Peter?
Well, we have lots. We sort of everything from the university-based systems, the central systems, which are, things such as inclusion services, counselling, learning disability services, but also, and perhaps more importantly, in the medical school, we have systems and processes. That includes a personal academic tutor that the students can go through, who hopefully is there throughout the 5 or 6 years of the medical student. We have student support leads, we have well-being leads. The transition, we foster that through the curriculum as well. So in the foundation and gateway year, it's at the same level as A levels, so it's level 3. So rather than teach chemistry, biology, and physics or whatever, we have a 3-week focus on a different topic. So for example, it might be children and young people for 3 weeks, and we deliver sessions, public health sessions, about what are the public health issues for children and young people, anatomy and physiology of the child and the young person, communication skills with children and young people. We have placement experiences for a couple of weeks. It's sort of core to what we do, and that starts right with the induction week all the way through. We also closely link to the first year students and beyond, and they come in and deliver sessions about what it's like in year 1, what sort of things, study tips. We have a study skills session every week. I know I'm talking a lot.
No, 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 it's interesting. Thank you.
We do lots of things. We also have, towards the second half leading up to year 1, as well as have the current medical students come in, and as well as having the same staff teaching all the way through, we do taster sessions such as CTBL, which is the way we deliver the course. They come in and do a 2-week taster session on that. The assessments mirror the types of the assessments that students are going into. A couple of weeks of placement experiences where you get an understanding of what placements are like, and it's really, you're sort of embedded in the same systems and processes that you're moving to in year 1. So what are the policies like? Who do I see? The way things work. I don't know if that sort of adequately summarizes it, but I feel like I've thrown a lot at you there.
No, no, thank you. And Chinedu, I'm right in saying you don't have a gateway course, or you don't have one at present. So, what do you do on your standard entry course to facilitate that transition between school and then university?
Yeah, no, that's a good question. So we mainly have our house system, as I mentioned, that builds a sense of community, sense of belonging, and it allows the students to connect with their buddies. So year 1 students are partnered with year 2 students, so they have someone they can talk to, ask questions. And similar to what Peter mentioned, we also have house tutors. Every student has a house tutor they're assigned to, who will check in on their academic progress and development, but also offer that pastoral care. And if any issues around finance, accommodation, mental health, any of these things come up, the house tutors will then signpost them to the appropriate service. For example, our in-house student support and well-being, but also the wider university has counselling services, finance support, writing skills development, things like that. So yeah, those are the supports available now. But we're always open to becoming more innovative in that as we get feedback from students and even from our partner colleges?
I think the main thing is that, I mean, it was a long time ago when I went to university, and I suspect there's a little bit more recognition about that transition than there was 20 years ago or
Yeah.
more. Couple of questions about gateway courses, Peter. And I should know the answer to this one, and I don't. You can't put it as your fifth option, can you, when you're applying? You can't apply to like four standard entry and a gateway course on your UCAS application, can you?
No, you can't.
No,
There isn't,
no.
no.
Yeah. So there
Yeah.
you four medical. If you can apply to the same school for two different courses, though. So
Yes, you can. And sometimes we have a situation, and every year we look at someone who's applied for the 5-year course,
mm,
who perhaps might not have got the grades but meets WP criteria, or might have got the scores, might not have got the UCAT scores. We go through, and that's just us, but we go through and look. So if there is someone who's applied for direct entry but they meet the WP criteria, we will offer them the foundation year if they're appropriate.
brilliant. Thank you. And um, people are asking if gateway courses are just for widening participation candidates.
Yeah, it depends on what you mean by widening participation. We have a focus on the Northwest and
Yes.
kids from sort of, or young people, I should say, not kids, from sort of looking at class related factors and backgrounds, where they live, schools, but it varies throughout the country.
Hmm.
I know, for example, Liverpool have a focus on mature students. So they might
Yeah.
not necessarily be from those particular WP backgrounds, but they might be older people who perhaps haven't got the necessary A levels or equivalent, and they want to go and study medicine. So my advice to you would be to look at the MSc website and have a look at
Yes.
all the courses to see what the
Yeah.
criteria are.
Yeah. And a little bit on contextual offers, because I think we understand what they mean, but they're not always immediately obvious to people reading documentation. So I'm just going to read this one out. Um, and this is someone's asked, I have seen medical schools where their entry requirement is AAA, but a contextual offer would be AAB. Does this mean a student who meets the widening participation criteria and is predicted AAB can apply? Uh, I mean, yes to me, but Peter or Chinedu, do you?
Yeah, it's
Yeah.
absolutely. We'll look at the WP criteria, and this is where it becomes difficult for you as someone going through the process. They differ normally from school to school and from university to university. But there are, certain apply, yes, and
Yeah.
sometimes even if you don't have a contextual offer, sometimes they'll accept AAB. And they might advertise, I shouldn't really say this, they might advertise AAA, but they might accept AAB.
Yeah, absolutely. Um, so there's a question here again. Why wouldn't a candidate who meets the WP criteria just go and enter a standard entry course instead of doing 6 years? So Peter, again, I'm sorry, this one is for you again, but you know, what, why a gateway course as opposed to a 5 year with a
Yeah,
contextual style?
and we do have candidates, or we do have students at the moment who could have got into the foundation year who are doing the 5-year course.
Hmm.
But it's a really good question, and I think the whole kind of rationale behind our foundation and gateway year, and most of them, is to support the students in the transition into higher
Yeah.
education, and that's just not academic support. And I think that's the first thing that people think of. So it's not just upskilling you in anatomy and physiology. It's also developing those academic skills, but also personally and professionally. It's about sort of giving the students that support through the transition into medical school, because we understand that for some people, it's an alien environment. A lot of people don't have parents or siblings or cousins who've gone to university before, so it's completely new, moving away from home and all of that kind of thing. Um, and what we do as well in the foundation year, as part of that, and a lot do as well, is offer you the opportunity for placements, a couple of weeks placements. Sometimes paid opportunities come through as well to support you, because we understand that again, most 17 or 18-year-olds can't easily access placement areas for volunteering experience, and that's invaluable. And that's not only invaluable for that experience itself, but we also introduce things such as reflection and the portfolio development, the e-portfolio, which will continue throughout not just the medical training, but beyond. Doctors will have that for the rest of their career. They'll have to sort of engage in a portfolio and an e-portfolio. So we find that after the foundation year, it prepares students better for year one than if you came in as direct entry. But it is, I do acknowledge that it is an extra year.
Yeah. So I would add two things to that.
Mhm.
One is Peter's contextual offer for his gateway year at Edge Hill is BBB.
BBB.
That will be significantly lower than most contextual routes into standard entry medical school. The other thing I would say is if you've got a student who meets those criteria, so you're thinking about their attainment. So what do you think their attainment is likely to be, whether they should think about the gateway or the standard entry? Also think about what Peter's just said about the activities that take place in the gateway year. They're designed to increase student confidence and, all of those things. So if you have a student who meets those criteria, but you think would benefit from that, it's definitely not a wasted year. It's an incredibly supportive year for those students, and that's what it's designed to be. So my advice would be to look at entry criteria and also think about the student in front of you, whether they would benefit from that or whether, they will absolutely fly in a 5-year, because there will be students who will, they're just ready. They're raring to go to university. So I think it's about the person in front of you, their likely attainment and their confidence.
Claire, can I just add one more thing?
Yes,
And I'll be very
please.
quick. It's just to highlight as well that the students who come in through the foundation year with Bs have gone to schools that perhaps aren't the best performing typically, but they perform as well in the
Absolutely.
assessments and sometimes
Yes.
better in some assessments than direct entry students. So that's a little bit to do with the course, but I think it's also a lot to do with the students who are coming in who have done well despite their educational background and opportunities or lack of.
I'm sorry, Chinedu, I've got loads of questions about gateway courses and you don't have one at the moment. But this is a really good question because it's about nomenclature and we do mangle it sometimes. Um, Is a gateway year the same as a foundation year? If so, why are there two names for it? Uh, I, yes, but look, there's yes, they are. They also get called year zeros as well. It's universities are unique beasts, and they will call things what they want to call them. But in general, the way that we split it up, there's one course in the country which we call a foundation course with a preliminary year, and that is a course designed for increase. It's for people who are, it's not a widening participation course per se, it's for people who have excellent A levels, just not in science. And it's like a science booster year, and then they go on to the medical degree. So, but yes, foundation gateway year zero. Unfortunately, I'd love to get everyone using the same term, but I think I probably won't be able to do that. Chinedu, I do have a question for you, and I'm not sure if you'll be able to answer it because some schools share this information, some don't. What generally is your was your UCAT score about your cutoff about last year?
The last time I spoke to the admissions team about this, it was roughly 2,600.
Okay.
Yeah.
Thank you.
I'm not saying anything, but I'm nodding.
Um, so the competition ratios for most gateway courses on the MSc website are about 20 to 1. Assuming a student meets the WP criteria and predicted grades, is it still a case that a good UCAT score is critical to getting an interview, Peter? Now, this will vary across medical schools.
Yeah, I can talk about our program at Edge Hill.
Yeah.
It's not 20 to 1.
No.
It's nowhere near that, to be honest. But we find about half the applicants don't meet the WP criteria. And we often get, and it's mostly geographical things, we get people applying, I guess, throwing their hat in the ring from anywhere. But it's the same process as the direct entry. So we have a 3-stage process where we look at grades, predicted grades, and then if they're on track, then we look at the UCAT scores, we decide a cutoff, and then we ask for interview. They're not not one is weighted more than the other. It's just a stage by stage process. But that, of course, means for the foundation year students, the predicted grades are lower. The UCAT scores are almost always lower. And typically the MMI scores are lower as well. But that's just the admissions. And I'm not saying these students are performing worse. They actually do as well, if not better in some cases when they're on the course. So it's yeah, those sort of things are lower throughout the whole process. It's the same process. They'll be asked for interviews. They'll be interviewed at the same time as our direct entry students, but we do differentiate between the foundation and the direct entry students that way.
Yeah, there's research to show that if you look at entry tariff and exit tariff, so to speak, medical schools add value. So and gateway courses add value. So you see that performance, whatever you come in with, it will level out and will be almost the same as people who arrived with higher grades. So we that's why we do it, because we know there's potential out there that is not necessarily measured in traditional A-level exams. Really quick one. Anyone been in clearing? Anyone?
Yes.
Yes. Okay.
So we've been in clearing a few times, and it's just I think because we've been really cautious. It's not that we don't have a number of applicants, but we've been really cautious with making offers. But clearing is an option every year, not for every course, but
No.
yeah, but there is an option.
Chinedu, have you ever been in clearing?
We haven't, no. If we normally go to our waiting list to fill the spaces, yeah.
Fantastic. Well, brilliant. Great panelists. Thank you so much. Really insightful. Great questions. We've used the whole hour and we've answered all the questions. So I'm really, really grateful for the participants today for asking such wonderful questions. And just a huge thank you to Chinedu and to Peter. We will finish there.